Hello, everyone. Good afternoon or good evening. Thank you, everyone, for joining us. For those unfamiliar with Zoom, I know it's hard to believe nowadays since it seems like everything is virtual. Just some housekeeping stuff. So we've got a Q&A and chat button at the bottom here for our team and myself to see any questions or comments, and there'll be some links and so forth shared there. If you're as savvy as my kids who do this at home, you probably know how to draw on the screen. So if you're seeing like a mustache or bunny ears on me right now, it's likely the work of my children. So hopefully that gives you a laugh. But we just wanted to thank you so much for, first of all, making the time for Angel Flight, for your support and for volunteering. We miss you. As you know, our staff is working remotely. So we miss seeing our patients, our volunteer pilots and Earth Angels in the office, our supporters and partners that come in. We're missing seeing many of you celebrating public benefit flying in general and Angel Flight West next week at our Endeavor Awards that had to be postponed. And just like you, we're all adjusting to the new normal, and we're doing our best to see how we can best serve through this crisis and be part of the solution that we all want to see. So our hearts obviously are with our passengers, the patients that need our services to access this life-changing healthcare that we enable with our flights. I heard a story actually a couple weeks ago, just before we had suspended our volunteer flown flights, from a mom whose child had brain cancer and needed surgery in Seattle. And she had called to let us know that the flight had canceled. And when we asked her why, they said that the hospital had informed her that any mortality rate of less than 30 days was being postponed or delayed because of the risks of COVID and the capacity that was being anticipated for the treatment. So I'm sure, like you, can't even imagine what that must be like to make those kind of decisions. And we support our healthcare heroes and partners 120%, who have to make these decisions all the time, right? Risk benefit for passengers, and we want to be there to serve through it. So with that said, obviously the current state of transportation to healthcare is tenuous. There's plenty of people that still need to access healthcare and are doing so. And we're working as much as we can to do that with them. Now, with that said, and as the example I just gave, that's pretty limited right now. For those of you following the news in California and Oregon and Seattle, or in Washington rather, they are starting to lift bans on elective surgeries. So the healthcare treatment process is getting back in motion. And our healthcare partners tell us there's going to be an enhanced demand for that, for those folks that have had to delay treatment or do telehealth. And that's primarily what's going on right now. For those people in treatment programs, many of which doctors are still saying, yes, your treatment schedule is more important than the risk of contracting the coronavirus, that we want you to continue. And so we are continuing to serve through that. I think most of you know through the announcement we sent out, we temporarily suspended our volunteer flown passenger flights and Earth Angel drives as the peak, hopefully the peak of the coronavirus outbreaks are happening now, and we can get through that spike, and we can reduce the risk to pilots, passengers, and drivers. But we are still helping our passengers. So we've got no Patient Left Behind Fund or Emergency Assistance Fund that helps those patients access ground transportation if needed, like a rental car. Our commercial airline partners, Alaska Airlines specifically, is continuing to serve and use social distancing and other CDC recommended guidelines on their flights and through the airports. And so we're working with our passengers in every way that we can that still need travel. What we anticipate, as I said earlier, is that surge in healthcare. And one of our staff members aptly pointed out to me, her name's Kathleen, that when Hurricane Maria happened in Puerto Rico, there was only 64 people that passed away. But the people that passed away after that numbered in the thousands because they couldn't get to healthcare treatment. They couldn't get to other essential services. And so the collateral damage was quite hard. And that's what's happening now. Yes, COVID is a real concern. It is real in terms of its impact and the people it's affecting. Many of you heard the story of our staff member, Rich Pickett, who serves as our safety officer, being hospitalized, induced coma, intubated. And we're so thankful and happy for him to come out of that and be healthy and make a full recovery. He's actually tuning in right now. Hi, Rich. We're so excited for that. So there's nothing to mitigate this, and the effects are everywhere, right? There's collateral damage on the healthcare side, our patients specifically missing treatment, deferring treatment, getting treatment with telehealth when possible, but those needs don't go away, and not receiving that treatment and those preventative measures obviously puts everybody more at risk in the healthcare community. So we're anticipating that, and we're trying to position ourselves again to best serve through it. So that's where we're at, and that's what this is about, is to update folks on where we're at, how we're reacting. We've just like everyone here, information changes by the day, by the hour. We've been proactive in pivoting towards those needs and serving the best we can through this crisis, and being part of that solution, as I mentioned. And on that note, I'd be remiss not to thank you. Thank you to our volunteers, our supporters, our partners, our hardworking staff. These are difficult times for everyone. We mentioned our patients already, but for our volunteers and staff and our partners too, it's hard. The economy is in a tough spot. People's own fears and psyches are in a tough spot. And we're really grateful that we can serve through this and we can be part of the solution, but we couldn't do it without you. So first and foremost, I wanted to thank everyone for your thoughts and prayers. They are definitely felt in times like these. I know our patients have remarked how incredible the pilots have been, some of which continue to buy commercial tickets and other things when they can't volunteer to fly to support these families. Many of you have been keeping in your thoughts and prayers our healthcare partners, these healthcare heroes that are on the front lines treating this and others that still need medical care. That need doesn't go away. We want to thank you for all the donations that you've sent. People have stepped up in this difficult time for everyone, and we know everyone's not in a position to give, but those that were have really stepped up to make sure that we can continue the same level of service that we need to, that we can meet this anticipated need, and that we could sustain our services. In many ways, this is unprecedented, not just for the country, but for Angel Flight too. Other than 9/11, when we were grounded shortly, we haven't had to suspend volunteer patient flights. And even then, we were the first back up in the air delivering blood and so forth. So we're excited to continue that service in crisis with some of our other efforts that I'll outline here in a little bit. And then I really want to thank the team at Angel Flight West. We're really blessed to have a tremendous group of individuals that have kept morale high and kept focus on the mission. We've got a small but mighty group of a dozen people that creates this platform to match volunteer pilots and drivers in need with healthcare patients that have to access healthcare. And it's been really inspiring personally to watch my team thrive through this crisis and rise to it. So with that said, I just give a little update on operations and where we stand currently. Many of you have seen the email updates, and part of this is to just give a little bit more information. I know if you're like me, you're sick of seeing COVID-19 update at the top of your email box. And so we wanted a little bit more interactive way to do that here and to discuss kind of what's going on. And really what a lot of people have been saying is just, how can I help? So that's here. That's what we're going to cover today. So in terms of our operations, adapting missions, so the current state is we have temporarily suspended our volunteer flown passenger flights. As you may have seen earlier, we had reduced our flights, one, based on the healthcare facilities response and patient response to having more and more elective surgeries and appointments canceled. And so we went to essential only, where the patient and doctor were telling us that the flight was essential, i.e. the risk of not receiving treatment was greater than the risks of COVID presented at treatment itself. And we had done that for a period of time. And then as the spike started and as we were personally affected through staff and otherwise about COVID, the board of directors made the decision to temporarily suspend this, keep monitoring the situation, come through with some proposals on how to mitigate those risks and how we can reasonably resume in as safe as possible, keeping in mind that safety is our priority. That was the decision that was made and how we've been operating here for the past couple of weeks. So with that said, like I said, we're still serving our passengers. We're doing that through our patient assistance fund. So that's booking commercial tickets, alternate forms of travel like rental cars, and hotels and so forth that are required now that there's more stay and longer drives, et cetera. Alaska Airlines continues to be amazing in donating tickets for passengers in need. Additionally, they have enabled a mileage donation program where they've donated millions of frequent flyer miles to help us arrange transportation for healthcare partners that want to travel to work on the front lines. So in the heavily affected areas like New York, Chicago, New Orleans, the Navajo Nation in Arizona, in our backyard, these healthcare workers are bravely, risking their own lives to serve others. So we want to applaud and recognize them for that. And Alaska is doing the same, and we're partnering with them to arrange all those flights. So if you'd like to donate miles, or if you know of someone who needs that type of transportation, you'll see on our page here and in the links in the chat how you can do that, and we'll send that as a follow-up to this as well. And then anticipating the needs early on for PPE, blood, and tissue that many of our healthcare partners had anticipated we would need, we've been able to get out in front of that in certain areas. This crisis is a little unique and a little different to other crises we've served in, like natural disasters, for example, where your infrastructure is threatened, right, because of flooding or power outages or whatever. This invisible opponent we're facing nowadays, our infrastructure is still there, right? So trucking routes are still open, cargo flights are still available, all those things. And we're not trying to reinvent that supply chain distribution at all, but we are trying to find opportunities where our unique resources might lend towards that. So the one that's been highlighted in some of the pictures you saw before this is a partnership that we have with a couple of other nonprofits, one called Project Cure and the other one called Make for COVID. And then with the Colorado Hospital Association, we're trying to scale this nationally as well. But what that looks like is these groups are making low or no cost PPE and donating it to hospitals that are most adversely affected. Colorado Hospital Association saw that the distribution chain of a lot of these relief efforts and PPE that we're getting in were being allocated all to the really large groups. And so in conjunction with the state, they started carving out a piece of that for rural hospitals who were by and large getting overlooked and also didn't require 12 pallets to put on an 18-wheeler and haul up across the Rocky Mountains. So thanks to our partners at Signature Aviation, they were able to deliver a portion of those to Signature, and then we arranged the flights to these rural hospitals across Colorado, Wyoming, and now into Kansas and so forth. And so we're trying to replicate that system. Project Cure and Make for COVID have been ramping up their volunteer efforts with some of these manufacturers and also from some other suppliers and distributors where these can be sourced. We continue to fly blood and in some cases tissue in relief efforts too. I will say, and tomorrow we're supposed to start flying actually some supplies from Utah into the Navajo Nation in Arizona. And I want to give a big shout out to our outreach team. So Ivan and his team have been working really hard along with our wing leaders and local volunteers to find these opportunities. And a lot of them, quite frankly, have been rabbit holes for the past few weeks. You're trying to navigate, someone says they need help, you follow up, and then nothing materializes. We also do have just a really small team. So it's another area where I invite help, and I'll outline this again a little bit later. But if you are, on a state, local, federal relief effort team or task force, or you have those connections with a hospital association, with someone that's making PPE or one of these other nonprofits or similar ones that I mentioned, and can do an introduction, please do so with myself or Ivan or anyone from the team. And we're happy to show them our resources and what we can do logistically, because we can take a lot off of the plate of arranging some of these smaller distributions of PPE. And that is really something that we've heard loud and clear from our volunteers. So thank you to everyone says, you know, I want to fly PPP in my area. We don't have a ton of these opportunities. We may not. Hopefully, you know, the crisis is such that a lot of these needs are stemmed, but if they're not, we want to serve and be as effective as we can at that. And we hear our volunteers loud and clear who want to volunteer their time, energy, and money to fly these things. So thank you for that. We really appreciate it. You see the links Henny is sending here to the team on some of that information about requesting these flights or how to get in touch with us. So we would welcome that. And that's really how we're operating. We're hit just like everyone on the financial side, obviously losing our major fundraiser. And I'll get into thanks for those that had supported that in a little bit. But that raised about a third of our revenue each year. And, you know, like everyone applying for PPP, sorry, I keep doing PPE and PPP. So payroll protection plan, we have applied for and are waiting on. So there's a lot of unknowns there. And then there's a lot of unknowns about the economy. So we're trying to plan and adjust to that as well and see what our operational impact will be. But, you know, as always, we're trying to plan for how we can best serve this very unique need that we meet, and there's so much more of it that we can grow into, and that's been our goal and will continue to be our goal. And thanks to our volunteers who are willing to donate their services for the people we serve and for these causes and healthcare. Our partners at Colorado Hospital Association say personal protective equipment equals people, right? The more of that we get in people's hands, the safer everyone's going to be. So that's saving lives and advancing health too. And so we're excited to pivot that way and continue to help there and plan for resumption of our passenger flights too, like I said, in a way that is safe and responsible and weighs the risks appropriately for everyone involved. So with that said, we've put up some addresses on how you can help. You can donate miles through Alaska Airlines. You can refer folks that want that transportation through Alaska Airlines. You can continue to refer patients to us so that we can walk them through how we can help in this time and how we anticipate being able to help here in the future. And also you can donate. So I mentioned earlier the No Patient Left Behind or our Patient Assistance Fund. You can restrict funds to that to help patients specifically. And then obviously with Angel Flight to help us serve through this time and for our sustainability, you can support there. And there's some information there on our screen on how to do each of those. So we would welcome your support and also welcome any of your questions. And, you know, I again, would really prefer doing this in person versus virtually and would have loved to a happy hour at our Endeavor Awards upcoming next week. But I did want to say thank you. Many of our sponsors stuck with us even though we couldn't have the physical event. And as we realized a virtual event wouldn't be sensitive to the current needs, we've poured in all our efforts on how we can best serve during the pandemic, but several have stuck with us, actually almost all of them. And there's some partial support I wanted to list below. So UCLA Health has sponsored us. They're obviously doing a lot on the front lines and couldn't join this call, but I just wanted to shout out to them. They've been invaluable in advising us through this crisis, as well as supporting us. And they're doing some really great work on clinical trials, research, et cetera, surrounding COVID, and also continuing to see patients in all other aspects as well. I want to thank AOPA, EAA, and NBAA both for their support for Endeavor, but they've also been a great resource in terms of how we navigate this from general aviation side. And you've probably seen a lot of those resources that we've put on our website. Robert and Leslie Zemeckis, Alaska Airlines, Southwest Airlines, Windermere Real Estate, Steve and Margie Dans, the Smith Foundation, the Marks Family Foundation, Matt Brown, Rish Conti, Mark Donnelly, Charles Anderson, and Ben Marcus, who when he gave his support at the beginning of all this. He marked it COVID proof. And when I asked him what that meant, he said, I think things are going to get a lot worse here real quick, Josh. And I would hate for anyone to pull support at Angel Flight when you're the exact type of organization that needs to be thriving during crises like these. So he's been raising that support with other folks and connections of ours too, and really appreciate that. And so much of that epitomizes what's so great about Angel Flight is we have really serious stuff where we could all be afraid and nervous and anxious, but we have a bunch of volunteers and a staff and partners that all want to roll our sleeves up and be part of the solution, which is just really inspiring. So I wanted to just thank everyone for that. And I also want to take this time to open up. I know a lot of people have questions and concerns, and so I want to open up those now and go through some of those answers. I see some of them coming in now. Hi, Peter. How are you? Peter asks if we could expect to fly materials in California like the Colorado wing. Yes, we are working on it. Actually, Peter, in your area, been in touch with some disaster response teams up in the Bay Area, one of which is working on a low-cost ventilator. There's no request yet on PPE. Again, if anyone knows of opportunities or things like this happening, we're happy to do that. And it's not just PPE, it could be blood tissues, it could be test samples. There's a host of things that we've been able to do in small chunks, but unfortunately not a lot in California currently. Stuart, hi Stuart, how are you? He asks if we're getting any connection to suppliers of healthcare devices that can use us for delivery. Like I said, a lot of the commercial manufacture of these, you know, the transportation and logistics aren't a challenge for them. You know, they can put them on a plane, bus, whatever. There are some groups in other parts of the country that are making these at no cost and delivery. So those are the ones that we're looking for. And we have delivered some ventilators in Colorado specifically, I know, that have been repurposed. So we'll continue to look for those opportunities. And Stuart, again, welcome. If you know of those opportunities, please let us know. Hi, Stephen. Thanks for tuning in. Stephen says, given the excess capacity that is likely to persist on commercial airlines like Alaska, do you foresee that AFW could persist more as a coordinator of trips on commercial flights and less of a coordinator on volunteer flying? In other words, could circumstances lead to a more permanent shift in AFW methodology and focus? Great question. So many of you may not know, about 20% of our flights currently are with commercial airlines. And obviously the flight profile of a commercial airline is very different from most of our volunteer pilots, which 75% of which are single engine piston planes, so 4- and 6-seat aircraft. And part of our kind of triage process for incoming patient requests is referring them to the best capacity, right? Is it commercial airline? Is it GA? Is it another resource or another nonprofit that can help them? So we make those decisions all the time, and we have really unique service delivery options. The sense that I get, just in general, with the crisis and the virus, and that people are going to be really tentative to want to fly in commercial airlines, first of all, which obviously gives me concern for our partners like Alaska, who are going to be threatened with decreased demand. And so especially immunocompromised patients flying commercially would be more difficult. And that's always a consideration for us, is that immunocompromisation and why we require medical releases and so forth. But could it lead to a more permanent shift? We'll see, perhaps. As you know, some of the rural places that you fly your plane, Stephen, it's difficult for commercial access, right? Even if you could drive to a commercial airport, it might be 4 or 5 hours away just to get to the airport, let alone the commercial airport, let alone to the final destination. So it's something we'll continue to look at, and again, and be able to pivot to. That we do have a couple partners like Miracle Flight, that's all they do is book commercial tickets, so that and we refer people to them all the time. So it could mean a closer partnership to groups like that as well. Jason, CalDART has been great. In fact, the white paper that we put out was a doctor from CalDART and one of our own doctors, who I'd be remiss not to thank, Hunter Hansfield, is an infectious disease expert at University of Washington Medicine, and did a white paper with CalDART group talking about how the virus spreads and the risks specifically in small airplanes. So if you haven't read that, it is available on our website on our knowledge base. It's also available at the University of Washington faculty site. But Hunter, as former board member, longtime volunteer command pilot, flies a 182 out of Seattle. And he's been really invaluable at advising us through this process and making recommendations. And he will continue. In fact, I'd like to put him on one of these so people can get some more specific answers to questions about the virus in general. But Jason's question about could we partner and better use AFW pilots as resource? We are in close contact with them. Paul Marshall is their executive director. And I know they are working on a few things. I don't know that they're flying currently, but we are a resource to them. We've actually done test runs and stuff with them on natural disasters. So that's something we can continue to look at. Jake Jacobs, fabric face masks. So a lot of folks are making these locally in their communities. And yes, we would love to accept any donations or deliver those to places that need it. We do anticipate coming out of this, face masking in general is going to be a recommended process, and it will be recommended at Angel Flight too. And so that to the degree that we can get those in the hands of our pilots or patients, we'd welcome that, Jake. Tom Moss, Lifeline blood flights. So good question. He is asking if those are going to resume soon in SoCal. Both our partners, Bloodworks and Lifestream blood flights. As you might imagine, these blood donation centers are affected as well. Less and less people are willing to go out and give blood. So there's been blood shortages, but in the meanwhile, hospitals are asking for them. So we do anticipate there will be more, and that they'll return soon, but they're weighing the same things that everyone else is weighing, because they have a lot of volunteers, they have staff, and how do you maintain that distancing and so forth. So I know UCLA has resumed a lot of their blood drives. I gave blood last week, so I anticipate that will happen to others soon. But we are in contact with them, and they have advised us, of their shortages and their processes. So we'll keep close tabs on that. Peter is asking, is Angel Flight membership command pilot status considered a legitimate reason for currency proficiency flights during shelter in place? And he realized it may vary between states and counties. So as this has, as I said, we've stayed proactive in this. As the first stay in place shelter, in San Francisco started, we've contacted all the states and local authorities to make sure that Angel Flight qualified as essential services. And we've gotten the feedback in every state that we operate in that we do. Some of our partners, like at Angel Flight Southeast, they actually have a FEMA letter designating them as essential services. In terms of using it to fly for currency, that is something longer term, depending on how this goes and how the FAA reacts. We may request for currency flights to keep our pilots current. We haven't done that yet, but it is both GA and Angel Flight is considered essential services currently. And I know that the FAA has relaxed their guidelines on some currency requirements in light of this as well. So that's how that is handled. I hope that helps. All right. How are other volunteer pilot organizations handling this situation? Great question. So I also serve on the Air Care Alliance. For those of you who don't know what that is, it's a group of volunteer pilot organizations that exchange best practices, advocate for GA both on Capitol Hill and more broadly, especially among the airport or the aviation alphabet groups. Each organization is a little bit differently. Most have temporarily suspended services in some fashion. Corporate Angel Network is doing 4 to 5 flights in corporate aircraft that they're kind of deeming only most life critical flights. Obviously, they can social distance and do different things there. Our partners at Angel Flight South Central are still flying a reduced number of flights, most, I think, exclusively to MD Anderson, and they're relying on the healthcare facility there to weigh those risk benefit for those flights. Angel Flight Soars in Atlanta is still operating limited. The rest of the groups are either flying some cargo flights or are grounded completely. Let me see here. Any other questions? I talked about blood missions earlier. Expected increase in patient requests. Does the office need additional volunteer coordinators? Eric, thank you for offering to volunteer. Yes, potentially we may need some. Right now we're able to keep up with demand. I actually talked with Sherry this afternoon, and our Alaska requests specifically are starting to spike. Sorry, Alaska for the relief flights. But you know, our staff is able to keep up. But yes, that may be an opportunity where we'll need more volunteers coming out of this. So thanks for your offer there. Umesh, thanks for your question about the UC Berkeley UCSF group. I would love to be in contact with them. So if you have a contact, great. If not, we can research that and follow up with it. Someone is asking if a large donor were willing to fund AFW to deliver specific tangible results in response to COVID, how would those funds likely be allocated? With whom should the donor connect? Would love to talk about that. That's a fairly broad question, and it would deliver which results, I guess, would be the response in terms of some of these cargo and supplies and blood and tissue, or versus passengers, et cetera. You know, we are really a platform, right? We're a group that is partners people in need with transportation resources that get them to point A to point B. And so as that, we're pretty efficient, and we leverage a large amount of volunteer resources, which was what makes Angel Flight so great. But in that, we have the ability, because of who we serve, where we serve, and the geographic ability, and that we're really rely on a software database to do that, to designate funds wherever folks most want to make an impact. So I've actually seen a couple of our funders on here that are very specific in their community to where they want funds allocated to, whether it be people with suffering from heart disease or children or a specific geographical area. And we serve each of those. So to that question, I would love the opportunity to talk with that. Our Director of Development is Mary Hunter. Her email is maryh@angelflightwest.org. Or my email, anyone can contact me anytime too, is josh@angelflightwest.org. And we'd be happy to talk through that depending on what those tangible results are that you're looking for. Someone was asking Idaho COVID tests and test kits from rural airports to and from Boise. We have not been involved with that. I saw another one come out of San Carlos doing the same thing. We have reached out to Quest Diagnostics and several other testing companies to see if we could help with that. So Vic, who asked that question, if there's additional need for that, that's certainly something we could help with. I know that our wing leader has been in touch with Idaho specifically on their response system, the governor's office, and they said there's no need for Angel Flight currently, but that could be. So that might be through a different group, and if you know that, I would welcome the opportunity to talk with them and see if we can. Doug asking, explore opportunities for AFW mission. Which elements of the government or industry should we query? Doug, this is, so each state has some sort of COVID response team, and there has been some connection there. The ones that we've gotten more traction with are more, so one group, it would be the hospital association local to your group, and then any nonprofit kind of in the PPE sourcing or manufacturing have been the best ones to start with. The healthcare industry, as I mentioned, we've been in contact with them a lot, but they're more doing right now than planning, except at the executive level when they're looking for sources. So that might be another possibility too, if you want to check there. Steve, thank you for your offer for flying PPE. Kurt, at what point do you see resuming passenger flights? That's a good question. So it's something our board looks at regularly. Currently what we're doing, and I mentioned Hunter, who's our infectious disease expert, and he's been providing recommendations. And we've created a little bit of a task force to look at some different phases of passenger flights and ways we could do it. Similar to actually what you saw when we were doing limited flights before, but perhaps with some more preventative measures. That will, the planning for that is ongoing. We'll take a good look at it May 1st in our executive committee meeting, and then May 8th at our next board meeting will be another decision point. But like I said, as new information becomes available, we talk really quickly, and I do want to give a shout out to our board too. They've been really responsive on short notice during this crisis as we've had to make these changes, and hearing different information from our volunteers and our partners. They've been really responsive and doing a good job. So we'll continue to weigh those, and obviously we'll be in touch with all of our volunteers regarding any decisions that are made. Hi, Edward. Likes to volunteer being an Earth Angel. Thank you so much. Again, unknown into when we'll resume Earth Angel trips. But we hope that those things will start late spring, early summer. We would love volunteers. That's another really encouraging thing to see during this crisis. The number of people that have signed up for our volunteers and gone through our orientation process has been outstanding. It will really help us when this anticipated spike in requests comes later this year. So yes, you can sign up on our website, www.angelflightwest.org. And then you're going to get a little COVID pop-up, but you can close out of there, or you can go through how else I can help. And there's a volunteer option. And you can sign up to be an Earth Angel there, or a volunteer pilot if you'd like. This is a question. Does AFW have a health safety protocol when we resume flying passengers? Yes, that is what we're working on. Prior to that, we had a knowledge base that we were doing that showed, disinfecting planes, best practices from CDC in terms of hand washing, face masking, et cetera. So that will be part of that plan when we come out of it. Yeah, someone was asking a question about Air Care Alliance. Hi, Raul. Yeah, so a lot of national needs have popped up through this, and Angel Flight West is looked at as a leader in the BPO. We've been around the longest. We're the largest and doing the most number of flights of the Angel Flight groups. So we've been really active trying to find out how we can replicate this nationwide. And Air Care Alliance has been really good. And Stefan Popiano, who runs the software that Angel Flight West operates on and that we made open source available to I think like 14 or 15 other groups. So we have been working really closely with them on some kind of national platforms. NBAA, same thing, has got a relationship with the American Hospital Association. So now we're working with them in their Hero Network for the anticipated needs there. Again, there aren't requests yet, but the partnership is in place, and they're doing a challenge to source a whole bunch of PPE. So we'll continue to follow on those, and want to thank all of our partners in the VPO community who work really collaboratively on the day-to-day, but especially during crises, to come together and serve the greater need. Tony responding to one of the other currency things about airports staying open, you can stay current. Answer the question about starting to fly people again. Jeff, I like that idea. Let's follow that up with Ivan offline about a specific Angel Flight blood drive. Oh, and Larry, thanks for your correction. the currency requirements have not yet officially been relaxed by the FAA, but that's what I've heard from my friends at the FAA, that they're likely going to be doing so because of the restrictions in place. But that should be published in AOPA the next few days. So thanks, Larry, for that clarification. Someone asking about testing protocol when we resume flights. As you all know, testing is not widely available. That is one option we're looking at for the resumption of flights. Thanks for the note of encouragement, everybody. Just make sure. So Doug was asking the same thing on the antibody testing and the other side. So in addition to Rich Pickett being come down with COVID, I've been notified now about a half a dozen other folks, one of which who's a doctor, that are COVID survivors. And that may be a path forward too for some of our flying, if we know our pilots are COVID survivors. Yeah, and there's some more question about testing. So yeah, those are all things that we're looking at. The availability of that is going to be the biggest inhibitor in the short term. Longer term, and following the examples of some other countries that we've seen, obviously some of those symptomatic testing and or rapid tests could be a path forward too, that makes everyone more comfortable with the risks involved and help us better prevent the spread. All right. I know we're coming up on our time here. So I just wanted to really thank everyone again. It's been a great opportunity, and I really appreciate all the folks that have tuned in. And like I said, reading all those names out loud made me miss seeing you guys in person, and seeing the direct impact of all the volunteerism that happens. And so I look forward to that time again. Before I wrap us, I also want to take this opportunity for those of you still on, if you could, through either the chat button or the Q&A button, let us know how often you would like to hear from us. And perhaps if a deeper dive into one of these areas, either our mission operations or outreach with one of our other staff, safety, and the things that we're looking at there, our infectious disease expert, Hunter, if that would be of interest, let us know frequency and topics that you may want to hear. I'm sure you would like to see something other than my shiny bald head and nasally voice. I think 45 minutes has been my max to hear that as well. But more than anything, I really just want to say thank you. This is difficult, and there's not a lot of right answers. And I've been really proud of all of our volunteers, our leadership, from our board down to our staff, everyone being able to serve through this together and be part of the solution. And you've seen it a lot in my emails, but I truly believe it, that we will rise above this together. Pilots, there's no one better than pilots to navigate turbulent times and to find the right altitude for smooth flight and maximize the use of our airplane. So we're going to do that, the same thing as an organization, and we will get through this, and we'll do it together. And I'm excited to see the other end and all the lessons we learned through this process, and all the people we were able to help because of the actions we made. So I just want to thank you again. Please contact us anytime with questions, concerns, and if you can just take a moment in here to let us know what you'd like to hear from us, how often, and if this is helpful, that would be great. And then, as I mentioned earlier on those links, how you can support, we'd welcome any kind of support. We know it's difficult times for everyone, so obviously no expectation, but whether it be volunteering, referrals, and or donations, we need them all right now, and we appreciate your time and your energy, and hope that it's been a good happy hour and that you've learned something new today. So thank you again, and all the best to all of you.